I've had this pesky cough. Some people have said they've been dealing with it for more than a month. Instead of dealing, it's probably smarter to be prepared for the unpredictable this cold and flu season. Back from the doctors, ER physician Dr. Travis Stork. It's good to see you again.
Happy holidays to you.
And to you as well, Travis. So how can we optimize our immune systems and stay healthy, not just now, but throughout the year?
You know, there are little tricks and tips. Obviously, I'm a big proponent of getting the flu vaccine for those who haven't gotten it. It's not perfect, but it is highly protective. And the other thing is, I always talk about the time between your doctor's appointments or when you can really optimize your health and your immune system. So it's staying hydrated, eating the colors of the rainbow. It seems silly, but we now know that if you get enough sleep, it actually boosts your immune system and even lowers things like stress and anxiety, which can ruin your immune system. All those things together with simple measures like washing your hands, not touching your face. And I'm also a big believer in nasal saline, whether it's neti pots or saline nasal sprays, to help keep your nasal passages moist during the cold, dry winter months.
Is that, I guess, is that just we're kicking on our furnaces and so the air in our homes dries out and our passages do too? Or what's the key cause of that?
Well, just wintertime in general, with the dropping temperatures, the ambient air is drier, but it is doubled by the fact that almost, most homes you walk into them and you're right, that furnace is turned on, the air is even drier. And also it's important to note that those long-term year-round allergens, the dust mites, the pet dander, those still exist. And so I always talk, when you talk about saline, nasal saline, not only are you getting rid of congestion and irritants, but allergies can be a big component during winter months of chronic congestion and also in many cases a chronic cough. And so the more you can minimize those allergens, also check your air filter in your home during the winter months.
I feel like you're talking to me specifically. I know a lot of people watching now relate to what you're saying, but it's this cough and it's like trying to find an answer for it. But how can you tell the difference between cold and flu and sinus infections? Are there telltale signs?
Well, the biggest thing with the flu is you're going to see systemic symptoms: fever, body aches, chill, headache, dry cough. You're going to feel terrible all over. With a cold, it tends to start from the neck up: congestion, runny nose, sore throat. And with a cold, you shouldn't really be to the point where you're bedridden, and you may feel really bad, but flu is definitely something that can be much more dangerous. The flu, we know, kills more than 30,000 a year with people who are at high risk. So the most important thing is, luckily, these are both viruses, so antibiotics are not going to be helpful at all. But the more that you can optimize your immune system and stay healthy, not only during the holidays but after, the more you reduce your risk of getting both the cold and the flu. And you can enjoy the holiday season without worrying about sickness.
And you talk about eating the colors of the rainbow. I know your new cookbook, the Doctor's Diet Cookbook, is getting some great reviews, so we'll plug that. Dr. Stork, is there a website where you'd want to send our viewers if they'd like to learn a little bit more about what we've discussed here?
Well, people can always go to our show's website, thedoctorstv.com. If they want to learn more about nasal sprays, they can go to armandhammer.com.
Sounds good, Dr. Stork. Thank you and happy holidays.
You too. Take care.